Thanks so much for joining our series of lives. Now, today we are going to be talking to Dr Helen Wall, who is an NHS GP, and she is also rather brilliantly the resident GP at BBC Breakfast and also the resident GP at Woman magazine. So this is one busy doctor. Now, she's made time for us in her lunch break to talk, although she covers a broad range of topics on her Instagram account, which is called Dr Helen Wall, as in DOCTOR. The one thing that we're really interested in is how neurodivergency impacts menopause. So I am going to try and get her on right now, and let's just add her. Okay. There we go. See if we can get her on. It's never straightforward, and it's different every time. Whoa! Superstar.
First time.
Hi, Helen.
Hi.
Oh, now, thank you. That was way too smooth.
You shocked you, haven't I?
Yeah, you have shocked me. Okay, so Helen, we were so interested to talk to you because although you cover a myriad of topics on your channel, the one that really spoke to us was neurodivergency, and how it impacts menopause. So I know we've only got you for 20, 30 minutes. Can we dive straight into the questions? Because I've got tons of them.
Yeah, wow.
Brilliant.
Okay.
Okay, brilliant. Okay, so firstly, can we start from sort of lesson one? What is neurodivergency?
Great question. So neurodivergency is sort of a difference in how people's brains function, really. I think for a long time we've just sort of labelled it as, this slight difference that people experience, but actually we've got real evidence now. We've got neurophysiological evidence, we've got post-mortem evidence, pathological evidence that there's actual differences in the brain function, but not just the function, at the structure as well. So there's real differences in people's brains, like the prefrontal cortex that does planning and execution, and ability to plan things and carry out tasks, right over to sort of your emotional regulation part of your brain, and it's all very much different in those with neurodivergence, and it covers an umbrella of terms from ADHD to autism to dyspraxia, dyslexia. There's a huge variation in that, and sometimes people will have more than one diagnosis. Quite often people will have more than one diagnosis, but it certainly is a tangible thing that we can see in the brains of those people with neurodivergence.
Yes, and I was understanding that it's actually physically different, isn't it? The brain could be smaller, larger, formed in a different structure.
Yeah.
So it is a physical.
Absolutely, yeah. And I think for a long time we've not really acknowledged that. I think when people say neurodivergence, I think they sort of think very quickly about ADHD boys who are hyperactive and disruptive and have behavioural issues, and there's so much more than that. Particularly for women, it's often very late diagnosed in women, and that's how I got into. I'm not an expert, I must say, at the start of this in neurodivergence. I'm a GP, I'm a jobbing GP, but I actually got curious about neurodivergence because of the things I was seeing in a menopause clinic that I run every week. I was seeing women who, I just felt there was something more than perimenopause. I felt like there was something that we were missing with some of these women, and started to do a bit of reading and a bit of research, and realised that actually many women are undiagnosed for a long time with neurodivergence because it just doesn't present the same. And if they're not naughty and disruptive and hyperactive, they're often inattentive. They internalise their symptoms and how they feel. That makes them anxious, depressed, burnt out. And a lot of them mask, they develop these abilities, wonderful capabilities to put structures in place around them so that they can fit in society and get those great jobs and get those great grades and get on in life. But actually it's exhausting. and then perimenopause hits, or sometimes puberty, or sometimes postpartum, so when they've had a baby, and the hormonal effects on the brain mean that they just can't carry on masking and keeping up those structures at that time.
Mm-hmm. So perhaps you might tell us a little bit more about why those two things are affecting. So you hinted at it there. It's to do with hormones.
Yeah, so we again, goes back to, and I'm saying these things as a GP who believed for many years that neurodivergence was mostly about ADHD in boys, and believed for many years that hormones primarily just affected our periods and our ability to get pregnant and fertility. And actually, as I went further into my advanced menopause training and started to see women who were very, very low in estrogen, started to realise that the estrogen has a massive effect on our brains, huge effect. It's neuroprotective for one, which is why it's starting now to be linked to all the studies around dementia. And does it actually reduce our risk of dementia if we have HRT, etc.? That's a topic for another day.
Yeah.
But it also affects our chemical messengers in our brain, so our ability to regulate our dopamine response and our ability to regulate our serotonin levels. And that's why so many women in perimenopause, when their estrogen drops, become anxious and low in mood and unable to sleep, and so on. And ADHD and other neurodivergent traits have been linked to dopamine dysregulation, so that dopamine seeking behaviour, that having to constantly switch from task to task, or more people with ADHD we know are get involved in substance misuse because they're constantly on that dopamine seeking behaviour. And estrogen plays a part in that dopamine regulation. And any period of your life where your estrogen drops, whether that be perimenopause or whether it be postpartum, when you've been used to higher levels in pregnancy and then that leaves your system, it can have quite catastrophic effects for women, who, particularly those who don't even know that they've got this underlying neurodivergence.
And so that's sort of the muddy puddle which I think we find ourselves in as midlife women. So we may have anxiety, depression, various other menopausal symptoms. We may be previously diagnosed as being depressive, maybe possibly be already on
Yeah.
antidepressants. Maybe we're on an HRT dose already. Maybe we're not. Maybe we're on both. How do we begin as midlife women to unpick where to start that with?
Wow, great question. It's huge,
Only,
isn't it? That is a huge, I see so many women who are, at that particular point. And often I think the problem we've got, I'm not really giving you a solution here, I'm sort of reflecting on the issues that we've got, is that we're just so underserved for women in our health service right now. It's very much a man's world still. There's been a lot of work done and continue to be done about menopause and perimenopause and access to the right perimenopausal services. But we're a long way from women being able to get a decent, timely access to that. And similarly for neurodivergence as well, we've got so many gaps in our services for diagnosing and managing neurodivergence that I think, first of all, those things need to get better. But I think for the women that are struggling, I think my thing that I've been trying to do on my channel is just really create that support network for women, because I think the first thing is often the women that I see are feeling very much fobbed off, unheard, unseen. Most of them say they feel like they're going mad,
yeah,
and they feel like the people they have touched upon in the health settings have pretty much affirmed that for them, not, or certainly not done anything to make them feel that that's not the case. And I think the first thing, we almost need to make sort of a social movement, a bit like we did with the menopause.
yeah,
Say, actually, this is not right. Women are not being heard, they're not being seen. There's real issues here that aren't being talked about enough. And we need to do that so that we can push for better services and better research into how hormones can impact on all these things.
yeah.
It's not going to be an overnight fix.
No. So it's like the menopause, it used to be a taboo subject. Now, well, it's absolutely everywhere, thank goodness. And we're unpicking so much of it. With neurodivergency, I think particularly in women, it's because we don't understand it, perhaps even ourselves yet. So if we're a woman watching this, and some of the perhaps could you start with what are the soft signs of being neurodivergent? If you're sort of thinking, this sounds like it could possibly be me, what would you be looking out for within yourself?
Well, there's very, very tight diagnostic criteria for all the neurodivergent conditions. Um, but I think the soft signs are often ones that people look back on and sort of don't really, they think, oh gosh, that's why I've done that for years. That's why I've felt like that. Things like, I mean, patients will say to me, I just felt like I never quite fitted in. I felt like I never really got the crux of a conversation when friends were talking. I never really got I took things literally when they perhaps weren't literal. I was very often black and white in thinking, this very like justice, having to have things be right or wrong, that inability to plan things in the mind, so feeling completely sort of overwhelmed, and that task paralysis is a big one, feeling like you've got so much to do, but you want to do it, you absolutely do want to do it, you're not lazy, it's really playing on your mind that you need to put that laundry away, you need to organise that cupboard, do that shopping, plan that holiday or whatever. But it just feels like it's just a big black hole and you can't get through that.
Yeah, sure.
And that's your part of your brain that's just not planning, your planning function in your brain that's not firing properly. Another big one for women actually is this, what we call rejection sensitivity dysphoria, or RSD, which is sort of when women fear, and I mean really fear, criticism or rejection, to the point where you've got a good group of girlfriends, you get on really well, but you don't even want to ask them to go to the cinema on a Saturday night or whatever, because you're fearful that they will say no, and then you will feel like they've rejected you. To most people that would not be a feeling of rejection, but for somebody with RSD, which is a part of neurodivergence, that can feel really huge, because the emotional regulation parts of your brain just aren't able to sort of see it the same way as perhaps neurotypical individuals, that it's just that they're busy or that they've got other plans, or and so it does affect women in a really day-to-day everything, work, relationships. They're just the biggest thing that women will say to me is, I just feel like I don't fit in. I've always felt like I didn't fit in, and there was something different about me.
Yeah, this is going to speak volumes to so many people, and it certainly does, personally, and also to friends, colleagues, family members. What does stress exacerbate the symptoms?
Well, I think stress exacerbates everything, doesn't it? And as a GP, I'm always saying that stress is a huge, huge exacerbator for every condition, whether it's physical or mental health.
Yeah.
But the brain is very much like a computer system, and if you overload that computer system, things are going to stop working and functioning. So, I think the biggest thing that I've found helps women is sort of just getting those soft, almost like mechanisms in place in their day-to-day life, so they can find ways to get around these issues. So planners and journals, and feeling able to be open and honest. I did some teaching on it was a talk really for workplace yesterday about neurodivergence in the workplace, and people joined that call, women mainly, and they said just the very fact that they were on that call with like-minded individuals, and they felt safe to say, I feel like this, I feel like that, I feel different, it made all the difference to them being able to carry out their day-to-day function. And I think the more we can talk about these things and understand that actually it's not an unusual issue, this 15 to 20% of the population, we think, do have some degree of neurodivergence, and it is an inheritable condition, more inheritable than height. So
Wow.
We think there's 27 gene loci which can be inherited, and how many of those you inherit from your parents, either or, determines how many symptoms or how prevalent your condition is. So if someone inherits one or two, then they may have mild traits of neurodivergence. If someone inherits all 27, then they may be quite severely affected. So it's a big spectrum, more inheritable than high, 80% inheritable. And that's often what I find in my menopause clinic as well. So women will come and they'll say, well, my teenage, because obviously when you get to perimenopause, often you've got teenage
Oh,
children,
yeah.
is currently being assessed for autism or ADHD. And I've started to realise that actually some of the things they're pointing out are part of that, or
Yeah.
might be part of that. I also have, and I just thought that they'd got that from me, but actually it's probably, they have got it from you, but they've probably inherited neurodivergence from you.
Okay. So where to start then, Helen? If you suspect that you might be neurodivergent, is it ever too late to get a diagnosis? And do you need a formal diagnosis in order to move forward with it?
Well, I think it's, first of all, for me, it's never too late to get a diagnosis, but it is very much an individual. It's an individual. See, I've got brain fog as well. It's an individual thing to do, isn't it? It's got, you've got to weigh up the pros and cons, and most people will say, at least I've got an answer now. At least I know why I've struggled all my life. I know why I felt like this. But there are some consequences to being diagnosed late as well. Sometimes people will feel quite sad, and it's almost like a grief reaction that actually, if they'd have been understood much sooner, if they'd have been heard much sooner and they'd had a diagnosis much sooner, then their life course may have been very different. They may have made different choices, they may have behaved differently, they may be in a different place now, and that can be quite a significant grief process for people to go through. So I think it's about weighing up which side of that coin you would feel best on, really. If you do feel like you are affected, there is plenty of information on the internet about how this presents now in women, because it is very often very different. And I would encourage you to go to something like the ADHD UK website, which has lots of really good resources, including screening questionnaires and tools, which are very black and white. So we can't take it can't take it as complete, but it gives you an idea as to whether you may be in that camp or not. And then I would go armed with that information to your GP and have that conversation with your GP, because I think going with some information and feeling armed will help you feel more confident. Take someone with you who knows, how you function on a day-to-day basis. That can be helpful as well, particularly if you're going to struggle with anxiety or feeling that you're not able to converse with how you're feeling. But I think the second part of your question is a really key message here that we need to really highlight. Just because you haven't got a formal diagnosis, does not mean that you can't start putting some of these things into place to help you, because getting a diagnosis can be a long process in
It's a
England right
12-month
now.
wait, I think, is
At
it?
least a 12-month
Yeah.
wait. In many places much longer. And I see so many people who are just sort of putting their lives on hold waiting for that diagnosis. And what I try and encourage them to do is, most people know by the time the light bulb moment's gone on and they've thought, this is, I
This is
realise
me.
now this
Yeah.
is me. You don't need that formal diagnosis. You can certainly get in the queue and wait for it, but what's going on. So start to access those support forums. Start to talk to other people who've got neurodivergence. Start to use the resources on support sites like ADHD UK, and Attitude and other great resources. Don't feel like it's an exclusive club, because I'll tell you something. I talk a lot about different things as a GP on my Instagram channel, and I have to say, and this is totally hand on heart, the one group of people who I get nothing but absolute support and engagement and love from is the neurodivergent community.
Mhm.
Honestly, like, I've done so many different reels on so many different things, and you always get trolls, you always get a bit of backlash, you always get a bit of pushback, but never ever with the neurodivergent community. It's such a loving, engaging
Yeah.
community in my experience. So
Fascinating.
empathic, so compassionate, so open and inclusive. I think if you think that might be your crowd, then get involved and get that support, because it can be life changing just to have that support. Not everybody needs medication. You can
Yeah.
change your life significantly. ADHD coaching, um, support forums, peer groups. There's
Yeah.
lots of things that you can do right now.
And so what would happen? Perhaps we do go along to the GP if we don't just self-diagnose. What if your GP dismisses your concerns? You can go ahead and do all those things. Should you keep continuing with it? Because everything that you've just said, you've kind of said, if you're our age, we can start helping ourselves. Would we expect to be medicated at the age of 50 plus?
Yeah, I think there are definitely people who get medicated. I think I had a patient who was starting to be medicated in her 70s, so
Ah,
it does happen. I think the difficulty is that once you have lived a large part of your life with all these coping strategies in place, then sometimes it's just correcting the hormonal differences, HRT, and looking at that can actually be enough to get you back on track. I think a lot of the medications for ADHD are stimulants, so there are contraindications and cautions with them. And as we get older, we have more reasons why they perhaps aren't right for us. You have to have an ECG, your heart, you have to have no cardiac history, etc. So as women age, often there's little bits of risk factors popping up, and age is one of those. That means that medication isn't the right answer. But it's about looking at the bigger picture, hormone profiling, medication for ADHD, support for ADHD. I think somebody's just made a really good comment in the chat about right to
right to
choose.
choose. Yes, I was going to hope that you mentioned this because it's important.
Yeah, it's important, and it's something that even a lot of GPs are not aware of, to be fair. I think we've got to be really clear that neurodivergence is a really big topic, and it's quite the new evidence is emerging and information's coming out all the time about it, and GPs aren't often up to date with that, because there are so many. We have to keep up to date with absolutely everything.
Of
Anything can
course.
walk through any moment of any day, so it is huge. I think if you can go around with information, and part of that might be to look at the right to choose pathways, because what would happen if a patient came to see me? We have a local ADHD service for adults, and I could refer you to that. But I know that there's at least a 12-month, 18-month waiting list for our local service. I also know, which some GPs may not know, so may not signpost you to this, that if you were to go on and Google ADHD right to choose referrals, you would come up with a list of all services that have been approved by the NHS for people to be referred into, and their waiting times can vary considerably. And many of them are online services, so you don't have to be in that geographical location.
Mm-hmm.
The difficulty is, if you are going to be medicated, some of those services will expect your GP to pick up the prescribing of that, and that's not always going to be doable, because not all GPs will feel able to do that on what we call a shared care
Yeah.
agreement, which again is probably a whole other discussion. But if you look on, again, I keep going back to, I'm not a member of AID, I'm not a commission for ADHD UK, but I do use this website a lot. If you go onto their website, the right to choose information does tell you whether they would carry on any prescribing, etc. So do a little bit of research around that and go armed with that information, because if you do feel like you're going to end up wanting medication, you may get to a point where your own GP can't issue that, and the service you've chosen
Yeah.
do that on an ongoing
Sure.
basis.
So, Helen, if our neurodivergency is affected so heavily by what our hormones are doing and fluctuating, should we expect that during menopause, if we start HRT, that with that consistency of hormone, that should calm some of our symptoms?
Yeah, absolutely. I think replacing the estrogen, it's mainly the estrogen, although I've done quite a bit recently on my Instagram channel about progesterone and how women
Yes. I
respond to
really want to
that.
ask you about that because I have a couple of friends that just say the progesterone and they think they're neurodivergent is the thing that's affecting them.
And there's a lot of studies being done about that at the minute worldwide. But I think certainly we know a lot more about how estrogen plays out in neurodivergence than progesterone at the minute. But certainly the estrogen dropping can have quite catastrophic effects on our chemical messaging within our
Yeah.
brain, our serotonin, our dopamine, and other messenger systems. So I think it's definitely worth addressing any hormone deficiencies if you are able to. And of course, not all women can take HRT
Yeah.
because of breast cancer or other reasons. So, but it's definitely worth thinking about having that conversation.
Yeah. Okay. So, if we imagine that do not have a formal diagnosis, and we're just listening to this chat now, and we're thinking this is us. What can we do? And I'm going to list when we finish this the ADHD UK website and the other resources, and of course your own Instagram, which is full of really good tips and tricks about how to manage neurodivergency. But are there any other things? For instance, does diet affect or help? Does exercise affect or help?
Yeah, there's lots of work going into this at the minute, but some of the things that are coming out are around, in terms of diet, are around particularly vitamin D.
Ah,
And a lot of us in this country, you'll notice that I'm outside on my lunch break, just having a minute in the sun, because vitamin D is not great for us in the UK. We tend, particularly over the winter months, to have low vitamin D, and we know that that can affect our brain chemistry now and impact on neurodivergence. So yeah, making sure your vitamin D is topped up, which is also very important for perimenopausal women and their bone health. Magnesium, there's some emerging evidence around magnesium and the effects on our brain, and omega-3 fatty acids as well. Those three things, making sure you boost those three things in your diet would be my top advice. But a diet and exercise affects everything, and I think often patients will feel like the GP's just fobbing them off a bit with that. Oh, you need to eat better and do some exercise. It feels like a bit of a, it can be in the too hard. We want a pill, don't we, sometimes, just to make it better. But
mhm.
actually, for all these issues, whether it's your hormonal balance, whether it's your mental health, your neurodivergence, having a nutrient rich diet and getting out in the fresh air and getting some exercise, even if that's walking. I think people often think exercise has to be hitting the gym.
Yeah. No, I'm a walker. I walk every single day
I've
without
noticed.
fail. It's my
You are
medicine.
always out walking, yeah. How much better do you feel for
I
that
feel
though?
incredible. And I did hear a podcast the other day that said if you hear 3 minutes of bird song, it keeps you happy for an extraordinary amount of hours afterwards because we're all animals, right?
Yeah.
It's natural to us, it's
Well, I've,
normal.
I've been sat here, listen, I've heard, how many, I've had 28 minutes of bird song now, so I'm set up for the rest of the day in practice
Yeah, you
shortly.
are. And
Um,
and I know that we promised you that we would not overrun 30 beyond 30 minutes, but I just have one more question to
yeah,
ask you, which I really want to know is how can we make this subject less taboo?
we've just got to keep talking about it. We've got to keep talking. We've got to keep doing things like this. We've got to
Yep.
take it into workplaces. So that talk that I did yesterday in a workplace, I think 25 women turned up, and there's hundreds of women in that workplace, and men. Men need to come as well. Um, but that's a great start, because even a year ago, I don't think we'd have been anywhere near that. I don't think we'd have even been doing that. So we've just got to keep talking about it. We've got to keep the pressure on for research and information. And the great thing, the thing that I always get great satisfaction from is I get patient people. I always call them, sorry, you're not all patients, some just women contacted me saying that was great, etc. I really feel this resonates, etc. But the thing that really, really gives me some satisfaction is when I get a GP or another colleague message and say, I didn't know that, can you send me the information
Yes.
about that? Because that would be one more clinician that is going to come into contact with all those other people who they can then start to see things differently for.
That's right. And I think, as being the women or patients or just people that you're referring to, I think that we also have to put our hand up and say, this is me, this is what I am, and be loud and proud.
Yeah, I think we need to celebrate more the great skill sets. I said this yesterday on this workspace. That neurodivergence is not all bad. That some of the best people that I've worked with have been neurodivergent. You know, that the ability to hyper focus to get stuff done, their level of empathy, their thinking outside of the box, the compassion. You know, they're just brilliant individuals, and we need to celebrate more that aspect of things as well, rather than just sort of be, oh, it's a, you know, it's a difficulty. It's a, I like to say it, that, you know, the ADHD is not a deficit, it's a
Yeah.
difference.
Wonderful. Well, on that very beautiful, positive note, Helen, thanks for your time. Thanks for giving up your lunchtime. And there have been an awful lot of people that have just gone through this live, and I know that it will zoom after we've been on it. So I will
Thank
share
you.
in the links your Instagram account, which is Dr. Helen Wall, as in DOCTOR. And there are plenty of resources on your channel. I will put in the links that you've mentioned today. And thank you again. Thanks for making this a huge conversation. We all benefit from it and
Thank
from
you.
you. And there's been a few doctors that have come on during this to
Same
say
here.
that they've learnt a lot just in this 30 minutes.
Yeah.
So little by little, we'll get there.
Thank you. Thanks very much for everything you
Thanks
do.
very much. And
And
thanks for everyone to join. Thanks for everyone for
thank
joining
you.
us. Bye.